The purpose of our organization is to provide help to families of children with life-threatening illnesses and to families who have had a child die. Our goal is to help keep the family intact during and after this time of need. We strive to minimize the long-term effects of parental and sibling bereavement. Despite amazing progress in medicine and technology, the unfortunate reality remains that children die. And payment and reimbursement for children's hospice and palliative care is a complex issue. We give comfort and strength to families of very sick children by providing medical care through registered nurses and medical social workers who are available 24 hours a day, 7 days a week. We work alongside the family through the months, maybe the years of care, and even beyond. The sick child carries a tremendous burden, but so do the moms and dads, brothers and sisters too. Although our attention is on caring for the immediate and specific needs of the dying child, we center much of our efforts on helping siblings, parents, and caregivers handle the effects of a child's life-limiting illness. Edmarc makes a unique contribution to our community. Our services prevent costly emergency room visits, plus our programs leverage community resources, private contributions, volunteers, and in-kind support from a broad range of donors. And the great thing is, these services are provided to families at no cost. We are helping children and families hold on to hope, however that hope may be defined. Edmarc helps promote healthy children and healthy family relationships, which ultimately benefit our entire community. Our effectiveness stems from our emphasis on family-centered care. We address the child's needs in the context of their physical and developmental condition, and Edmarc's processes, systems, and policies then respond to these needs. Flexibility, continuity, cultural and ethnic sensitivity, and education about caregiving responsibilities are just a few of the important components we employ. These support services maintain family cohesion, sense of control, satisfaction with care, and informed decision-making. To be successful, we've learned to think and operate like a business. In planning for the future, we have evaluated our strengths and weaknesses, studied and measured our audience, and developed timelines and strategies for growth. We measure our success in 3 distinct areas. We monitor the number of patients receiving clinical care. We count the number of families, brothers, sisters, moms, and dads receiving supportive counseling, and we track the number of families receiving bereavement care. In addition, we conduct exhaustive surveys of the medical professionals about the role Edmarc plays in the healthcare team. Even more importantly, we survey our families to ensure that their needs are being met. Unlike other human service agencies, Edmarc would prefer to serve a very small number of children and families, and could close our doors and not be needed. But sadly, the number of families needing our care and support is on the rise. When most people think of hospice care, they usually don't think about children, perhaps because the concepts of children dying and death don't go together in our society. Likewise, the words children and hospice shouldn't go together, but they do. When people think of hospice care, many think of end-of-life situations. Although this is true, there are many children who get better and are healthy discharges from our program. Children are resilient and they can bounce back from things that we as adults cannot. And because children are afflicted with such rare disorders, we don't know what will work. So we owe it to them, as well as their families, to treat them as aggressively as we can, hoping for remission and/or cure. As the first hospice in the country designed for children, we've become the model for other programs. Our programs support parents while providing comfort and treatment for the child. We do our best to treat the illness aggressively with the overall goal of extending the life of the child as much as possible. And because the organization receives only a small percentage of its budget from reimbursement, Edmarc has developed community support beyond reimbursement structures to maintain the work of the agency. We are about providing hope for families, hope that we can treat those children who can get better, and hope for families whose child dies, that they can somehow rebuild their lives and create a new normal. Children aren't little adults. They don't live like us, and they certainly don't die like us. When a child becomes seriously or terminally ill, their needs are very different from those of an adult and require a different kind of treatment. National research highlights a number of important themes that are barriers to pediatric hospice and palliative care. There's been reluctance of medical personnel to refer to pediatric hospice by name. They feel as if they have to give up hope on a child. We would use additional funds to field current and ongoing clinical and support needs. In our efforts to lessen the burden of a terminally ill child, we'd like to expand our clinical program to be able to serve more children at any given time. It would also give us the opportunity to perform a feasibility study to determine service growth and funding potential. Over the years, Edmarc has been approached by professionals and families outside of our current service area who are seeking care. We hope to meet this unmet need with additional support. A gap we would love to fill would be to add an anticipatory grief program to our repertoire. This would improve the quality of life for individuals and families experiencing anticipatory grief. Some experts in the field think this type of grief is actually worse than post-death grief, because we're always on alert, waiting for the end to come. Edmarc is the logical choice to lead this effort, to help children and families cope with their anticipatory grief issues. Our hope is that we can obtain the funding in an effort to care for children and families by providing the love and support they need while ultimately improving their well-being.